Governor Herbert's power to declare a state of emergency for COVID-19 is facing some pushback from lawmakers. They're holding hearings and planning bills to push back on some of his authority.
Fox 13's Ben Winslow is live on Capitol Hill to explain what is happening. Ben.
Lawmakers have been holding hearings all day here on Capitol Hill, scrutinizing the governor's ability to keep Utah in a state of emergency, as well as the far-reaching powers of health departments.
The state of emergency is intended more for short-term, quick emergencies. So it's always been for fires, floods, earthquakes, those kinds of things.
Lawmakers are discussing how long Utah should be in a state of emergency. Utah's been in one for COVID-19 since March and only recently transitioned to a public health emergency. The law gives the governor 30 days to take charge, but some in the legislature believe they should be more involved past that.
We're kind of in new territory and we need to make adjustments.
They say the laws never envisioned a pandemic.
And I think that as opposed to having all of that power reside with some bureaucrats in a local or state health department, I think for a prolonged, sustained, longer than 30-day public health crisis response management, we need to have some checks and balances in place just to make sure that things don't go completely off the rails.
But not everyone feels that way.
Talking about our public health experts as government bureaucrats, they're trained professionals that have the health of our community at heart.
In a statement to Fox 13, the governor's office says he's been careful to use his emergency powers when necessary to protect the health and well-being of Utahns, and will be discussing these decisions with the legislature.
The legislature gave the department the responsibility and specific authority to investigate and control.
The legislature is also scrutinizing the power of health orders. Health departments can issue orders that do things like close restaurants or swimming pools to protect public health, but for lawmakers, the pandemic has highlighted the reach of that power.
So I'm trying to figure out where you see the line on control.
Health departments do answer to local elected officials, but they have wide latitude. State and local health officials say it's necessary to quickly get a handle on a public health emergency.
Orders are a tool that we use, and they don't require that public involvement, even though we seek it where we can.
Now, as you heard, those bills definitely in the works. They could be considered for a special session being talked about for November or the 2021 session that begins in January. Live on the Hill, Ben Winslow, Fox 13 News, Utah.